Brock University acknowledges the land on which we gather is a traditional territory of the Haudenosaunee and Anishinaabe peoples, many of whom continue to live and work here today. This territory is covered by the Upper Canada Treaties and is within the land protected by the Dish with One Spoon Wampum Agreement. Today, this gathering place is home to many First Nations, Métis, and Inuit peoples, and acknowledging reminds us that our great standard of life and living is directly related to the resources and friendships of Indigenous people. Might I also take a moment to acknowledge the tragic and senseless loss of life as a result of the terror attack on a London, Ontario family as they went about on an evening stroll around their neighborhood this weekend. Good morning and welcome to this session of Business Breeders, a live webinar series hosted by Goodman Group at Brock University. My name is Abdul Rahimi, and it's my distinct pleasure to serve as the director of Goodman Group at Brock University. Goodman Group is a community-focused learning and development services provider that works to support professionals, businesses, and entrepreneurs pursuing growth through professional development certificate programs, executive education, consulting services, and startup support. It is my pleasure to welcome you all to today's session as you take your break with us. This webinar series aims to provide 45-minute breeders filled with insightful discussions on timely topics that are relevant to businesses and everyday lives, led by award-winning Brock University faculty and leading industry experts, feeling as connected as we all get through this. In a moment, I will hand the screen over to the panel and today's webinar lead, that's Ken Chan. Ken, Vanessa, James, and Leslie Ann will speak for approximately 40 minutes, and then we'll spend some time answering your questions. Some of you have already posted your questions at the time of registration. Thank you very much. You may also pose your question live during using the chat feature during this session. The live and comments, Goodman Group, all one way. Our webinar will be as of June. Also, including as assistant and at Can you hear me?
Hi there, Abdul. Thank you, Abdul, and the Goodman Group for inviting us to be part of Business Breeders. And thank you to the audience for joining us. So, over a year ago, the World Health Organization declared the COVID-19 outbreak as a global pandemic. And our lives changed significantly due to public health measures that altered the way we interact with each other, how we learn, work, and do business. And only about 6 months ago, the Canadian government approved the use of Pfizer's and Moderna's vaccines, followed by AstraZeneca's and Johnson & Johnson's. Many saw the vaccinations as the path to the new normal. We will focus today, this webinar, on how some businesses have stepped up to vaccinate their workforce, and in doing so, provide a surge capacity to the public health system by helping to vaccinate non-employees. And we're joined by leaders from 3 Canadian companies who were involved in the planning and rollout of vaccination clinics at the workplaces: Maple Lodge Farms, Bruce Power, and Air Canada. We have Vanessa White, Chief Human Resources Officer at Maple Lodge Farms, James Kongak, the Executive Vice President for Corporate Affairs and Operations Services at Bruce Power, and Leslie Andezina, Director of Employee Travel and Recognition at Air Canada. And I had the opportunity to work closely with Vanessa, James, and Leslie in recent weeks on the planning of their respective workplace clinics that also have been helping members of the broader community. So in a couple of minutes from now, I'll be asking each of them to share their insights with us, what motivated their companies to do this, what they learned, and their contributions to the community. But before we do so, I'll just take a few minutes to provide you with an overview of the vaccine landscape here in Canada. As the vaccines are all manufactured abroad, the federal government has taken on the responsibility of procuring vaccines from the manufacturers. Parallel to that, the federal government, through Health Canada, is responsible for approving new drugs, including vaccines. And nationally, there's also an expert advisory committee on immunization that issues guidelines for use of the vaccines here in Canada. Each province and territory is responsible for prioritization of who gets vaccinated and when, relying on best and latest scientific data. The provinces and territories are also responsible for the planning and distribution of the vaccines. And therefore, you'll likely see differences in approaches depending on where you live in Canada. I want to focus a bit on Ontario's rollout. So in Ontario, the government established the COVID-19 Vaccine Distribution Task Force to lead and oversee the planning and delivery of the vaccination program across the province. In Ontario, the strategic administration of the vaccine mostly rested with the 34 public health units, and they're supplemented by hospitals, pharmacies, and primary care providers. Of course, there were special operations driven centrally by the province, such as Operation Remote Immunity, led by Orange, the Air Ambulance Agency, on behalf of the province. And this operation kicked off in the winter of 2021, and by the spring, all 31 Northern Flying First Nations communities were visited by flying vaccinators. So Ontario's rollout was undertaken through a three-phase approach, starting with our most vulnerable populations, those living and working in long-term care homes and high-risk retirement homes. And that went through the prioritization framework as set out by the province based on advice from medical experts. And as you can see from the timelines here, given stable supply of vaccines from the federal government, the province has been able to accelerate its rollout. And today, the province has moved ahead to kicking off rolling out second doses. I want to spend a couple of minutes speaking about hotspot communities. The Science Table, which is an arm's length independent body of experts that provide advice on the response to the pandemic, has recommended that based on modeling, that certain communities are at greater risk of COVID-19, and that because of that, their recommendation is to advance and prioritize those living and working in hotspot communities, including essential workers. And these communities were organized by FSAs, or Forest Sortation Areas, and that's the first 3 digits or characters of our postal code. And the Science Table recommended this spring that hotspots be prioritized for vaccinations for those essential workers who cannot work at home. So you can see here from the slide, in April this year, the province announced that it would be working with local public health units and businesses to set up workplace clinics. Workplaces would need to be in hotspots and have either experienced outbreaks or are at great risk of outbreaks. And the businesses were asked to plan, set up, resource, and operate these clinics, including securing their own vaccinators. And this was to provide surge capacity for the public healthcare system, which will also avoid cannibalizing public resources, especially frontline healthcare professionals. The local health unit or the province would provide the vaccine doses. No doubt, as you can see, this was time-intensive and a very costly exercise. Now, Peel Region was the first to embark on this initiative, likely because a significant part of the region had FSAs that were designated as hotspots. And in fact, the majority of employee-led workplace clinics were in Peel Region. And this was also due to the fact that in addition to hotspot status, there were many industries, food processing plants and distribution centers, for example, are located in Peel region. And the demographics of this workforce also meant that additional steps were needed to make vaccines accessible to people working in those facilities and who cannot work at home. So in total, over a dozen employers participated in Peel region's workplace clinics, including Maple Lodge Farms, Maple Leaf Foods, Amazon, Air Canada, HelloFresh, Walmart, Loblaws, Magna, Purelator, Canada Post, Ellisdon, The Gap Inc., and Canadian Tire. And Bruce Power also set up a workplace clinic in Great Bruce County, working with the local public health unit there to vaccinate their employees. So these companies also supported vaccination of the broader community in their own ways. For example, Amazon set up a 5,000-person clinic at the Dixie Gurdwara, a Sikh place of worship in Mississauga, Ontario. So you're going to hear now from Vanessa, followed by James and Leslie. Vanessa, over to you.
Thanks so much, Ken. And thank you. This is a great opportunity for me to thank you publicly for all the support that you gave us at Maple Lodge Farms as we worked hard to make our workplace vaccination happen. So doing an on-site vaccination clinic was really critical for us based on the demographics of our workforce. As Ken has mentioned, not only are our facilities located in hotspot regions in Peel, but certainly the vast majority of our employees also live in hotspot regions. You know, our workers have significant language barriers, and I will also say some cultural barriers. So getting easy access for them to vaccines in a place that they trust was really critical to reaching you know, the levels of vaccination that we were hoping for. And I'm proud to say that across the three workplace sites that we did, we're today sitting anywhere from 70 to 90% of our workforce with first dose vaccines. So that's to accomplish that in 8 days was pretty spectacular. You know, we did this for many reasons, but the primarily one is this truly was for our frontline workers. As essential workers, our employees have just been so dedicated and so brave. And I'll say that food processing, and particularly meat processing, is in a unique space where our workers are often very overlooked. And we're also, you know, really ostracized and have been through the beginning of the pandemic. So we saw this as the ultimate thank you that we could give to our employees. For all the great work that they've done over the last, I guess now, hard to believe, almost into 18 months. So we ran 3 locations for 8 days. We administered about 1,300 vaccines to our employees at our employee clinics. We are a 24/7 operation. So we were running our clinics from 6 a.m. to 10 p.m. daily. We partnered with Dynacare as our clinical services provider, and they were just an amazing partner to work with for our on-site support. And then, of course, lots of our own administrative staff volunteered to help make our clinics happen. So just an incredible amount of work went into making it happen. You know, we've learned lots through our clinics. And I think, you know, Ken, you asked us to share our key learning, and I'll do that in a minute. But first, I want to talk about in the top left picture there, you see that was taken at the clinic that we hosted in partnership with the Malton Masji in a hotspot neighborhood in Peel. Again, we worked there with it was Maple Lodge Farms, the team from Malton Masji and Dynacare, as well as we had some support from the local Malton BIA. And together we brought 8 days of clinics directly to a hotspot neighborhood. So again, this was a neighborhood where people may have had a hard time navigating the public system to get to a community site. So much like the workplace clinics, the community pop-up clinics were really important in helping us achieve our vaccination goals across the province and certainly within Peel region. So I think that I had two key learnings, and one is I think we proved the theory that we started with on this is that you have to bring vaccines to arms because it's not always possible to get arms to vaccines. When you do that, when you bring the vaccines to the arms and reduce the barriers, people are very excited and willing to get their vaccines. And I can tell you that our employees were just incredibly grateful. And then I think the other thing I learned is that a pandemic can take a crack and make it a canyon. So certainly whether that was, within our workplace policy, whether that was how well resourced local public health organizations are, whether that was, how a province and a region and an employer might work together on something like this. Where you think there might be cracks, they really were canyons. But the willingness of everyone to come together and fill those gaps and just make this happen was truly, I don't even know that I have a word for it. Ken, maybe you do, but awesome, I think, is the closest I can come. This was hours of work to make this happen, and now we're just excited for second dose clinics.
Thank you, Vanessa. Touching and inspiring, the two which I'll add to the discussion here. Thank you, Vanessa. And next, we'll hear from James. James.
Great, thanks. Thanks very much for having me, Ken, and I really want to thank Goodman for holding today's session. And just before I talk about what we were able to achieve from a Bruce Power perspective, and very consistent kind of theme of the other speakers, I really do want to acknowledge Ken for his tremendous leadership across Ontario as the Assistant Deputy Minister of the Secretariat responsible for this. During a pandemic, what I find is people complain about everything, and that's okay because it's tough for everybody. Every single employer I talked to, every public health unit I talked to said, thank God for Ken. So congratulations, Ken, and you're a great catch for Goodman, and it will make a great difference there. From a Bruce Power perspective, I just want to maybe set the stage to give you a little bit of a sense of who we are. We're not as well known of a name as the other two speakers. Bruce Power, we operate the world's largest nuclear facility in southwestern Ontario. We generate about a third of Ontario's electricity, and we generate 40% of the medical isotopes that are used around the world for the purpose of sterilizing personal protective equipment. And so in addition to that, we also have a multi-year infrastructure program on our site that's the largest private sector infrastructure program in Canada. So like the other two of my colleagues, we're a 24/7 operation, and safety first is obviously our number one value, but we are providing an essential service. So we really looked at our vaccination strategy in three pieces. The first piece was in the January, February, March timeframe was recognizing that workplace vaccinations were not going to be happening anytime soon, and really that reflected the prioritization that Ken shared. So we worked with the Grey Bruce Public Health Unit and established three what we call hockey hubs. You can see some of the pictures here. These hockey hubs were developed by our medical officer, our health doctor, Ian Aaron. We established three of these hockey hubs at three arenas. We totally set them up, and the goal of those was to make sure that when the community had doses, that public health had the resources to administer them. And one of the things you learn very quickly in a pandemic is that what happens in your community, if there's an outbreak in your community, you're going to have an outbreak in your workplace. And so our first step was to help the community. Then our second step, working with Ken, was to say, when doses were available from a workplace vaccination perspective, how do we take this model and set it up on our site? So between Bruce Power and Public Health, we set what we call a mini hockey hub up. And in the course of 7 days, 4 clinic days, we administered about 3,800 first doses. And those were for people that could not work from home. And we're currently working, hopefully early July, to administer second doses, of course, based on availability and whatnot. Obviously, with our community well positioned and our employees taking care of the first dose, we partnered with 30 other companies across Ontario and Ken connected us with the Region of Peel. And you'll see a picture in the middle there at the CAA Centre. We set up the largest, what we call, mass vaccination site in Canada at the CAA Centre in Brampton. It actually has the capacity to do up to 10,000 a day. Obviously, we'll never do 10,000 a day, but as Ken talked about, resources and capacity are absolutely essential during the pandemic. We plan to run that clinic to the end of June. We're planning a record day this Saturday of likely somewhere between 6,000 to 7,000 over an 8-hour period. And then what we'll do, working with Peel, is this hockey hub will be dismantled into 3 pieces at the end of June and likely redeployed at their 3 other sites. So once Peel optimizes and learns the process, now taking that and establishing 3 hockey hubs or leaving this hockey hub in place. So, it's the pandemic's been really trying. We can't minimize all of the tragedy and heartache that has brought. But on the flip side, I think throughout the province, there's been a lot of organizations and people at their best and just tried to make a difference. And so, anyway, Ken, I appreciate the opportunity to join today and look forward to the dialogue.
Thanks. Thank you very much, James. Leslie.
Thanks, Ken. Yes, so similar to Vanessa and James, I just want to say a big shout out to you and a big thank you to you for all your help and support over these past few weeks. It's been truly amazing working with you. Thank you to Goodman for inviting us here today. And thanks both to James and Vanessa for their inspiring stories. It's really nice to hear how other companies, we sort of share these similar experiences, things that we've never had to do before or been faced with before, and what we were able to come together and create and put out there for our employees and their families, etc. So from an Air Canada perspective, our stories are very similar and a little bit different as well. We have set up 4 different clinics across the country, and we started back in March out in British Columbia in Vancouver. We were approached by the Ministry of Health out there, and they wanted us to set up a mass vaccination clinic for the community, so not specific to our own Air Canada employees, while they would be welcome, but this would be more about the community, similar to what was our clinic was assigned, was sort of a hotspot area at the time. So while we were thrilled to engage in that, and what you sort of see by my title here, Director of Employee Travel and Recognition, my regular day job kind of went to the side because, as you all may know, there's not a ton of activity happening in employee travel lately, unfortunately, nor on the recognition side was where I used to get to host a lot of glamorous events. So when I was asked to get involved in the clinics and start managing and partnering and running these clinics, I was thrilled, but of course, zero experience. But you can really see when working with different companies, different healthcare providers, etc., even though you don't necessarily have that experience, just the will, if you will, and the support of your teammates and the different companies and the Ministry of Health, we were able to pull it off. So the Vancouver clinic is a mass vaccination site, and very similar to James's. It's a hockey hub model, and we are currently vaccinating 2,500 to 3,000 people a day still. So it's just this sort of ongoing nonstop pace. So once we got that one up and running, we thought we'd be good. We thought we kind of knew what we were doing. And then we were approached by the province of Quebec. But in Quebec, they wanted to go to select companies, but they were only offering a certain amount of clinics that they would give to companies to vaccinate their employees. So they asked us to partner to seek out different companies within the province with whom we could partner with. So in Quebec, we ended up partnering with Bombardier and ADM, which is Aéroport de Montréal. And the 3 of us then created 2 different clinic vaccination sites in the Montreal region. And this clinic was specific to our employees and their family members. So these ones at the time of opening, were not open to the public. And that worked out great. But because there was a little bit of a lag in this one, and a lot of our employees had already received their first doses from other sites at the time, we quickly had to reinvent ourselves, to keep those bookings coming, because, we had no longer opened and people were already asking about, how about second dose? How about second dose? So we quickly reinvented ourselves, and presently at the Aéroport de Montréal location, we are vaccinating seasonal farm workers And at the Bombardier site, we are actually busing in some of the school children and some of the special needs kids as well. So, you know, we're constantly sort of reinventing ourselves, and that's something that we've learned here too. Like that long ago, 6 weeks ago, 8 weeks ago, we quickly sort of need to readapt and reinvent ourselves to keep that momentum going until we get to second doses. And then finally, we were partnering with you guys, Ken, and you reached out to us, and we were very happy to open a clinic in the Peel region, and this was an exclusive Air Canada clinic for our employees and their family members. And we were so grateful and so happy to be able to do that, because of course, as you can imagine, as we are sending out these notices to our employees and, you know, hey, we've got this great clinic, and hey, we've got that great clinic in Vancouver and Montreal, the majority of our employees are actually based in Toronto, so you can only imagine the amount of feedback and requests we were getting about, hey, what about us here in Toronto? Are you going to open a clinic for us? We want one, you know. And of course, Peel was a hot spot where a bulk of our employees were also located. So that was super helpful. It's been going wonderfully. The feedback we've been receiving is amazing. And I guess one important factor that I have not mentioned is that everybody working at this clinic, all the non-medical staff, we actually reached out to our furloughed employees. So we have rehired over 200 employees who have been furloughed since the beginning of this pandemic and have offered them paying working positions at these clinics. So the response from, you know, the employees themselves and even the unions, believe it or not, because that's always a little bit of red tape we had to go through as well to actually be able to hire these people. But the response has just been amazing, because for us at the end of the day, what's most important is the safety of our employees, their families, you know, the community. And the quicker that we get these shots in arms and everybody vaccinated, the quicker we hope to be able to be back to business, back to our regular lives, and get everybody back to traveling, hopefully, amongst other things. So thank you so much. We're just thrilled to have been a part of this.
Thank you, Leslie. And the common thread amongst the three presentations here and the context I provided is Peel region. And I want to take this opportunity to thank and acknowledge Dr. Lawrence Lowe, the Medical Officer of Health in Peel region, and his team, Paul, Steve, and Jeff, and others, for stepping up to do this. I said earlier that 34 public health regions in the province of Ontario, and there's one that's stepped up to take on the task that's not been done before, and that's in the form of this innovative private-public partnership. Business Breathers provides an opportunity for our audience to take a break from our day jobs or our studies to learn about trending topics that focus on innovation, leadership, and social impact. Vanessa, Leslie, and James have taken on additional tasks above and beyond their normal day jobs. I know they said it's other duties assigned, but I also say it's a testament of their personal leadership and the DNA of who they are, especially in a business environment now where society expects to see the good in business. So to each one of my colleagues, Vanessa, Leslie, and James, thank you for stepping up. Thank you for persevering. And it's not always, and saying this as someone who spent time in government, it's not always easy to work with government, but you never gave up. You reached out, you challenged me and my colleagues, and ultimately we see the benefits of this model here. When Abdul asked me to speak, I jumped at the opportunity to use this webinar to share this innovative approach where business and the community have come together to roll out the vaccines. We all know the last year has been tough for so many of us. And while millions of people shifted to remote working, there are so many who cannot because of the type of work that they do. And we're talking about people that kept the supply chain going, whether it's those folks working in cargo at Air Canada, the folks that supplied power to Ontario and beyond, and the people that kept our grocery shelves and fridges and freezers stocked, like the work that's being done at Maple Lodge Farms and elsewhere. So this is one such an opportunity for us to share with you the intersection between employee wellness, what these employers and others have done to look after the well-being of their workforce, and also the tie into corporate social responsibilities, an area that business schools are and have been paying close attention to, and especially now in a COVID-19 era. Abdul, before I send it back to you, I want to, just on behalf of the panelists here and Brock, just say thank you to the frontline healthcare workers and volunteers for all that they've done over the last year or so in responding to the pandemic, and also stepping up in December and working long hours to vaccinate millions of arms across Canada. I had the opportunity yesterday to sign up, and excited to share with you that Brock University is running 4 days of a mass immunization clinic on campus, and I've been accepted by Niagara Region Public Health as a volunteer. So I'll get to do 2 shifts in July, and right here on campus. Again, coming full circle, having worked in behind the scenes, to being able to contribute on the front lines as people get their vaccinations. So with that, Abdul, thank you for having us, and I'll turn it over to you.
Thank you very much, everyone. It's an absolute pleasure having you here. So we do have a few questions, and if I may, I'm going to start this first one, and this is for Leslie. How quickly were you able to set up the clinics from when you were asked, and how did you work to reinvent yourself quickly? And can you speak to some of the other behind-the-scenes items, like in terms of the size of the team that was involved, the various sites that might have been involved, the various hands in making that vision of having that clinic into a reality?
Sure, that's a great question. Okay, I'll try to be short. I am a little bit of a babbler, so feel free to mute me. I'm sure you have a massive mute that you can use if need be. But I will say that we certainly got better with time. BC was the first clinic that we opened, and the largest, and probably the most, I would say, difficult, probably due to our lack of experience and just trying to get everything up and running so quickly. So I believe that the BC clinic took us about 4 to 5 weeks to launch. So that was literally from the first day that we were told, hey, we need you to do this, and B, hey, you need to be live on this date. So I'm not going to lie, it was a lot of, or a little bit of, oh my gosh, how are we going to do this? And then once you sort of breathe through that and say, okay, it's okay, like anything else, you're not alone. Build your core team of people, because as I'm sure Vanessa and James can attest to, this is not something that us as individuals did. This is something that absolutely required so much collaboration and teamwork. It does sound a little bit cheesy, but literally this cannot be achieved without teamwork and setting up a core group of people whom that you can count on, and whom that can kind of go out there and get some of that, just the stuff done, because there was just not a lot of time to, in a perfect world, we like to project plan and do all these mappings and all this kind of stuff. And while we did do a little bit of that, it was a lot more of fly by the seat of your pants. And, as Ken also mentioned, in a polite way, but it definitely was a little bit of wrench. In dealing with governments, it's a little bit different. Full disclosure, my first experience, and it was tough because, when you're sort of putting out these questions and you're getting an answer, and then sometimes it's like, kind of sort of maybe, or you do get an answer, and then you kind of move forward with that. 8 hours, something has changed, and the answer is a little bit different. So you course correct. So I think really sort of having to let go of that, this is how things need to be, because I am very much a planner and I like things on paper, letting go a little bit of the rigidity of how I would normally do things, and sort of surrendering yourself to the fact that things are able to change, things are going to change and you can kind of just roll with those changes. I think that brought down the level of stress quite a bit, just sort of letting go. Certainly sharing with your team the same things, because, you know, you're also giving direction to different people, and then you're having to sort of come back and say, hey, yes, sorry, time out. I know I said this yesterday, but guess what? Now we're going to do this, but it's okay. So keeping the energy up, and I think reminding people of what the end goal is. And the end goal is, you know what? We have this opportunity to do something that we've never been able, we would never do before. We're essentially a part of history here, helping to get our public, the community vaccinated so we can all hopefully have a part in putting an end to this and move on with our lives and go back to normal, you know, if you will. So I don't know if that answers the question. I don't know if you need a little bit more. Oh, Vanessa has something to add. Please go ahead.
Go ahead, Vanessa.
I'm going to start by saying I'm incredibly jealous of your 4 to 5 weeks because, and I know why Ken is laughing, we got confirmation on a Wednesday, late in the day, and we started our first clinic, our biggest clinic, because why do the small one first, the following Tuesday. And so I would just echo exactly what you said. And I will say we didn't start from scratch on the Wednesday. We had gone to the province with what I would call kind of a half-baked plan in advance. So, you know, baked as much as it could based on what we knew. So I had decided late in 2020 that this was going to happen for us and for our employees if I had to move mountains to make it happen. So I had my team actually, and to your point, a really small team of people that I just knew could make it happen. They got started. I actually challenged them in January to say, how we have one of our values at Maple Lodge Farms is we have what we call a how might we attitude. So I said to them, how might we vaccinate 1,600 people and not disrupt production, because, you know, food production doesn't get to stop for 3 days while you vaccinate people. How might we do that and keep our operation running? And they all thought I was crazy, but I will say that having that half-baked plan really helped us demonstrate to the province that we were serious and that we could make this happen. The other thing it did is that small group of people, for the first time in almost a year, they were working on something that felt like hope. And so the energy and the passion that they brought to it was huge. So, and then, yeah, we got to the Wednesday before, and they said, could you start next week? And we said, of course. And then we were like, you know, I'm calling the team saying, hey, we're going to do this next week because I just told them that we could. And they said, you're crazy. And I said, yep. And then we made it happen. But, you know, it was the little things. And Ken, I know will recall this with perhaps fondness. It's funny now, but all along, you know, in all of our discussions, they kept saying, you know, vaccine temperature control for storage is so critical. Like, you have to be able, and we're like, please, we are a meat processing facility. We keep things at a perfect temperature all the time. Well, as it turns out, keeping things at a consistent temperature in a really big refrigerated building is far easier than keeping things at a consistent temperature for 5 days in a refrigerator. And so, you know, that was just last minute panic, but we figured it out. We got it done. You know, and it was 1,000 little things like that. And then, yes, certainly the legalities of working in what I would call a public-private partnership, really challenging. And again, because everyone had that, we need to do this and we're going to do this attitude, we got through it, but that doesn't mean it was easy. I think we worked on our legal agreement until almost midnight on the night before we started, and I signed our final drafts, which we couldn't put a vaccine in an arm until we had those signed. Sorry, not drafts, the final contracts. I signed 15 minutes before we opened the door on our clinic. So, you know, there's a book out there, it's Morgan and Barden, called A Beautiful Constraint. So if people watching haven't read it, I really recommend it, because, you know, the whole theory is that you often achieve excellence when you're dealing with constraints. And this was just the prime example of it. And like you, we learned a lot as we went along. Now we're at second dose clinics, and we're like, when do you want us to start? We could probably start tomorrow. We're good. But yeah, it was just overnight conversions of entire spaces, and yeah, stuff we just never dreamed we'd be doing, yet here we are on a webinar sharing best practices.
Excellent. Thank you, Vanessa, for that insight. Ken, what were some of the challenges from your perspective, looking at it from the ministry and from the government perspective?
Yeah, I think, you know, the one thing I learned very quickly about the vaccine rollout is there's no textbook for this. And even if there are guidelines or how to do things, things pivot, things evolve. What we were told about the vaccines in December is not what it is today, whether it's dosing intervals, whether it's temperature requirements. Things change and things evolve. And when you have people who do this for a living, people in healthcare, public health units and hospitals, pharmacies, that's one thing. But when you get businesses who are in the business of food processing, meat packing, in the business of nuclear power generation, in the business of airline, this isn't your day job. And I'll just keep it in context. So when the government announced in early April that we would be open to working with businesses, there were hundreds of emails, and I've got hundreds of emails between my team and I about wanting to do this. And the one thing that I did was to be very transparent and upfront about the difficulties in getting this done, because many self-selected to say, as much as we want to do it for our employees, we can't take this on. Cost has been a barrier for some. Others is identifying the people who could take this on. There isn't a textbook. And then when you think about some of the requirements, and Vanessa touched on the legal aspect of it, there is a significant consideration when it comes to health privacy. And one of the things that we were all mindful of was to ensure in the world of health privacy and ensuring that employees don't feel like they're being watched by their employer, is the requirement that the database, the COVID's on in Ontario, for example, the registration system is handled by healthcare workers or third-party providers. And we want to avoid a situation where companies have access to health data, because once you're able to log on, you can see who's been vaccinated, who's not been vaccinated, and that's something that we want to avoid. So that was a critical piece that we had to navigate, which means the companies doing this will have to add to the costs people who undertake the actual registration and information data entry there. The other has to do with quality assurance, quality control. And they have to do with, Vanessa talked about the temperature control for vaccines. Other also has to do with ensuring that we don't waste vaccines. So one of the questions we very quickly asked employers is, do you have a list of people you can call on short notice to come in towards the end of the vaccination day to get vaccinated, because we don't want doses to go to waste. So those are just some of the many steps that employees have to undertake. So it's not an easy. I have folks to say, well, we've run full clinics every single year. We can just do this no differently. But as you've heard from Vanessa, James, and Leslie, that's really not the case there. So again, you know, for those businesses who took this on, again, a testament to the commitment to employee well-being and corporate social responsibility.
Thank you, Ken. This next one may be for James. And you spoke about running one of the largest mass vaccination clinics. And then speaking of the constraints and perhaps lessons learned, what might be some of the key lessons that you would pass on to the second dose clinics that are coming up and are starting up?
Yeah, so at the Peel Clinic, it is run by Peel Public Health. One of the things I think to cut all public health units and the government a bit of slack, and I kind of learned this as we were going, was as a company, you're focused on that initiative, and it's the most important thing to you. And what I learned very on was all of the people within the government and public health we were dealing with, they had been on this marathon for 14 months. And their time horizon for decisions or concerns is 72 hours. Our time horizon for things is a week or 2 weeks or 3 weeks or 4 weeks. And at first you kind of think, hey, are these folks disorganized? But then you actually, the more you work together, you just realize they've been trying to get through the day for 14, 15 months. I'll tell you just, I don't know if this is a direct answer to your question, but I'll tell you the one thing that really helped in our organization, and it was the leadership position of our CEO. And I'm not just being nice because he's my boss, but I'll give you an example. The Sunday before we started the vaccines, we were really worried about a whole bunch of things. You know, are people going to stop work? Obviously, we'll keep the core things going safely. That's never in doubt. But a lot of concerns, well, are we going to stop work with this? Is this going to be interrupted? What about this? And he got on a call with all the leaders on Sunday and said, the top priority at this site next week is to get everybody who is eligible a first dose. That's the top priority. He said, we have been in this hell for 14 to 15 months. Let's not forget, this is the way out of it. And I thought that was really good because he kind of took the conversation up a level and sort of said, you know what, if we, nobody wants to lose, like, you know, Vanessa's in processing, Leslie Ann, you know, time is money in all of our businesses. But he set the tone that said, you know what, this is the top priority. Because if we get it, we were never worried about it. I say we were worried. We felt very confident in the safety of our workplace. We were really concerned about, in particular, tradespeople who were living in settings in the community together, or carpooling into work. And we were terrified people were going to get COVID off-site. And so from our perspective, the first dose was all about taking, from a safety perspective, the risk of a death or somebody ending up in the hospital down pretty darn low to zero. So, you know, I think sometimes when like people like Leslie Ann and Ken and Vanessa were in the middle of this, these things, but our CEO took it right up to the right level. And that was a good leadership learning for me, to be honest, because he sort of just cut out all of the stuff and said, the top priority is this. I don't care. Go and make it happen.
Thank you, James. And perhaps time for one more question here. In thinking of the public part and private partnership, I guess this is for Ken and others as well. What was the inspiration? What was the inspiration behind it? Was it that the companies came to the government first, or was it the government going to the organizations, or was it simultaneously, organically, the two sides coming together? Are there any examples of public-private partnerships elsewhere, would be in Canada or outside, that this may have been an inspiration and a model for?
In Ontario, it was the businesses who stepped up and came to government. I went to the Premier, went to the ministers to say, we want to do this, let us do this. And certainly the Ontario model and approach has been, let's use existing public resources, the public health units setting up, the mass immunization clinics, using primary care providers, using the pharmacy channel, hospitals stepping up to say, we'll run mobile clinics. But companies came to the Ontario government to say, let us help you, let us do this. And even within government, there's a lot of discussions around the merits of doing this. And certainly picking up on James' point, leadership is key. Premier Ford did hear from quite a number of senior executives, CEO from Maple Lodge Farms. James is part of the Ontario Chamber of Commerce. With Magna leadership, speaking with the Premier's office team to say we want to do this, and certainly Air Canada has also approached to say, hey, we're a top employee in the GTA. We want to keep the skies open so we could keep trade going through the cargo, and that's really Vaccinate first, the people working in cargo. So that's the kind of consideration when certainly when I took this to the leaders to say let's consider doing this. The one key we needed to use to unlock was to find a willing partner, and Peel Region was very quick to come forward to say, we're not going to say no. We want to understand what this is all about. So that's really, I think, was critical. We started with 3, which eventually grew to over a dozen, mostly in Peel Region. But again, as you heard from James, Dr. and Aaron and Grey Bruce was also a pioneer. They needed more vaccines, so the province stepped up. My colleague, Minister of Health, says, yes, this makes sense. Here's a couple of thousand doses to keep it going. The other thing I also found very inspiring is, day to day, companies compete with each other. Or if you have no need to talk across industries, there was no reason to do that. And I still, recall how willing 3 of our guest panelists here were to help others. Leslie Ann and her team, they had experience out in British Columbia. So when businesses reached out to say, hey, we want to learn more about this, I said, hey, Leslie Ann, can you present what you did in BC to people who will be, I think there were about 30, 40 people on the call, perhaps even more, to get a sense as to what that meant. The CEO of Linamar, which is an auto parts manufacturing company, did partner with Guelph Wellington Public Health Unit to set up a mass immunization clinic. Also came on to talk about their experience in setting up a workplace vaccination clinic. And after Maple Lodge Farms rolled out their clinic, one of the first to go, in fact, the first to go and kick off, I was sending people to Vanessa. Vanessa was talking to people who typically would be in a competing space, people who were in the business of courier delivery, nothing to do with food processing plant. But certainly that comes to show when we're in the war against the pandemic, we all step up. And then, James is certainly taking their hockey hub model and sharing that across industry, across the province. So this is what I would say. It is, like Abdul, to answer your question, like there is no other model out there. There isn't. And if it takes a pandemic to bring us together, I like to, I like to think that in the new, better normal, there is something to be said as a business school about the types of research, the type of education, the type of dialogue we're going to have in terms of what corporate social responsibility and working together means to better the lives of all we're here to serve and the people we live and work around.
I want to thank all of our guests here, Ken, Leslie, James, Vanessa. Thank you so very much for coming here, dedicating time to share your insights and the challenges and the opportunities that you went through, and for obviously the work that you've done behind the scenes to make these stories possible and turning these into as much a success story as is the case. Goodman Group is a community-focused learning and development services provider that works to support professionals, businesses, and entrepreneurs pursuing growth through professional development certificate programs, executive education, consulting services, and startup support. And Goodman Group's latest professional development program is open for registration, and the area of focus is data and data-driven decision-making in particular, which allows individuals to focus on and hone in their skills around the area of the various areas of data science, and combining that data and with their intuition for higher and better quality decisions. Information related to this program is on the screen, and registration seats are open. Should you have any questions, please reach out to myself or a member of the team here at Goodman. Well, that is all that we have time here for today's Business Breeders session. Thank you all so very much for tuning in and taking time out of your busy schedule, but also thank you for catching your breath with us here today. Joining me next session is Cindy Watson, who will be focusing on the reframing of negotiation for a better feminine negotiation perspective. I hope many of you can join me next time. Until then, stay